Hi, this is Julie Lubinsky. I'm web manager for the Christopher and Dana Reeve Foundation. I'd like to welcome you all to this month's Dr. Dan web chat, and we'll be talking about anger today. Let me tell you a little bit about Dr. Dan. He's a practicing psychologist and therapist with more than 40 years of experience. He is best known as the host of Voices in the Family, which is a weekly radio program that was heard on WHYY in Philadelphia. He is also the author of 6 books, including the one that he always talks about a lot is The Wisdom We're Born With. And now I am going to let Dan take over.
Thank you, Julie, and thank you all for joining us. I want you to know right at the outset that we had a lot of people registered, but there's only a few of you on the line, so this can be your show. So remember, we're here for you. So make sure you chime in with your questions, your concerns, and you owe it to yourself to make sure you get what you wanted out of this. So Julie, you there?
Yeah, I'm here.
Okay. So, you said you had some questions about anger.
I do. It's not like personal anger, where I'm angry, but it's also how to cope and deal with others that are angry. And it could be people you don't know very well or someone very close to you. It's hard sometimes to know when if someone's expressing themselves to you or confiding in you, if they're just looking for an ear or if they actually want some real advice. So especially when anger comes into play, I don't quite know how to answer that. Answer them back or just try to be a good listener.
Well, first thing, you, Julie, or you, listener, or you, spouse, friend of this chronically angry person, the first thing you have to do is take care of yourself. I mean, if you are feeling assaulted, if you are feeling injured or hurt or exhausted by this person, then, you have to back away and set a boundary. I'm not talking about, a Facebook friend. Well, there too, I guess. But you have to take care of yourself. It's critical when facing an angry person. That said, you keep in mind when you're facing an angry person or anybody that's getting on your nerves, remember the phrase over and over and over again. It's not about you. Someone is expressing anger constantly, Julie. It means they're suffering. They're suffering terribly. Imagine having all that cortisol in your belly, all that time. I mean, they are suffering terribly. And anger, is, we heard from, I said is a reaction to injustice. And what I said in my text that I wrote on the bottom, and I know it was very long. I don't know if you had a chance to receive it. But chronic anger is poison. Body, mind, and spirit. But acute anger could carry valuable information. So, like I said, it's a reaction to injustice. So that's how the world's changed, right? It's anger at injustice. I'm a baby boomer. That's how the Vietnam War ended. It was our anger. That's how civil rights came to be, and gay rights, and so on, and women's rights. It comes out of anger, not violence, but anger. So, acute anger carries valuable information. I'm not so sure we should stand up and fight everybody in the world, but it carries valuable information. So, like I said, one person, chimed in and said, he or she wasn't getting good care in the residence they were in. Well, that's just awful, and what are your choices there? You can be passive, or you can do whatever you can to to get the care you feel you need and deserve. Now, you're not going to get that with a clenched fist. You're going to get that by looking someone in the eye and telling your story, and hopefully someone with authority, and hopefully someone that's going to look you in your eye, so you can be two humans, and one of them saying to the other, look, I'm suffering here. Please help me. Are there any resources? So, we have to use our anger to make change. And we can't use our anger to hurt ourselves. So I really went all over the place, Julie, with your answer. I have no idea if I addressed it adequately for you or not.
You did. The first thing you said was, I have to, that this person who is suffering, and I have to remember that. I have to remember that it's not anger towards anybody, but it's the expression of this person kind of reaching out like a red flag.
Yeah.
So that helped a lot right there.
And my dear friend, Julie, you have to take care of you, too.
Yes.
And if you are hurt or overwhelmed, please take care of you. Promise?
Yes, absolutely. I have to, yes.
So somebody else said this, Julie. Let me see. Give me a second. Somebody else said that they felt abandoned by their child. Let me see. But they didn't quite use the word abandoned. But my daughter, he said, he or she said, has become a stranger to me. I'm torn between rage and I couldn't read the end of the sentence for some reason. But, deep hurt can turn to anger. And my God, feeling abandoned by your own child. Sure, you don't know what to do. The body sometimes, the body-mind, cannot tolerate that deep a hurt. As weird as anger is, as painful as anger is to carry, anger is less painful than that kind of hurt, feeling abandoned, and that kind of hurt of feeling rejected by someone you love who theoretically is supposed to love you. Julie, when you feel abandoned like that, really, the body-mind has one of two choices. Either it's their fault, and that's anger, or it's my fault, and then it's shame, or deep hurt. But it's hard to, hold on to that when you're feeling abandoned. I think it's one of the most painful things that can happen to us. So here we've got Lynn Rauer, and Lynn, I hope you don't mind me using your full name here. But Lynn says, I'm going to have a conversation with you, Lynn, even though you're not on the phone. And if you do want to have a conversation with me, I'd love to talk with you, darling. But Julie, Lynn said, how do I deal with the anger at the doctor that did this to me? Well, Julie, first of all, I would love to know, if you don't mind, if it's not too personal, I'd love to know what happened to you and where and what your options are. But, like I said, anger can motivate you to do something for yourself. This patient that I referred to had horrible things done to her at the hospital. She was supposed to have a temporary colostomy, and instead the doctor screwed up the surgery, and she had a permanent ileostomy, which is higher up, puts her at much higher risk for infection and shortens her life expectancy. And she was furious. And, she couldn't manage her anger. All she did was lash out at people. And, of course, that doesn't help. That just makes her the, quote, angry patient. And therefore, she's less likely to be heard. But if you're able to find someone there, you can look in the eye, who can hear you, you're likely to, get the response you need. If it's after the fact and the doctor's not hearing you and there's nothing that can be done, I don't know, when I was in the hospital and I was enraged at the company that caused my accident. I'm not allowed to use their name, but it's a tire and rubber company that starts with fire. Anyway, when I found out they did it, I was enraged at them. And, I didn't know what to do with my rage. And a friend of mine said, hire a lawyer. And, I hired the lawyer. We went after Firestone. I didn't find justice, but at least I found something to do. And here I am all this time later, and I'm no longer angry. But Lynn, I'd love to hear more from you about, what happened to you and about this doctor. Oh, here she comes. I went in for a spinal cord because of pain and ended up with paralysis because he did no imaging before the operation. Lynn, now I read that. Now you got me angry too. I hate to hear, people suffer with medical malpractice. So yeah, you're right. How do you deal with the anger at this guy? There's one thing I don't want you to do. You be angry at him as long as you want. You can have your violent fantasies about him if you do have them. Stay angry. But if I hear from you a year from now and you're still this angry, then you're suffering. There's a point at which, and it's certainly not now, but there's a point at which you have to release your grasp. And I'll tell you when it happened for me, Lynn. It happened for me when, a couple of years later, I realized that I was living my life as a quadriplegic, and I had a life. Until then, I thought my life was ruined because of this tire and rubber company. But, I had a life and I didn't even realize it. And that's when I was able to release my grasp. Then do me a favor, tell me when this happened. I'm just curious, if you don't mind. And by the way, I really appreciate your logging in here and sharing some of your story. We've got others there. Let me read this other statement. The question that I asked was, do you feel angry as a result of what's happened to you? Yes/no. Yes, because I can't do what I did before my wreck. No, because I could be. I don't know why these are getting cut off, Julie. Do you?
No, but if you hover over them, you can see the longer answer.
Not getting it. But I can deduce. Yes, because I couldn't do what I did before my wreck, and no, because it could be worse. Whoever wrote that, I'm reminded of a statement a sociologist wrote about grief. And he said, grief is the rope burns that what we have clutched so tightly is pulled from our grasp. And it's kind of what happened, you know, it's what happened to you. Anger because you couldn't do what you did before. And that's what we do, don't we? We hold on to yesterday. You know, we look back at yesterday and we think, damn, that looked so good. And you'll never have it again. And that's the anger. I want what I had yesterday. I want who I was yesterday. That's the anger. That kind of anger is really grief. It's really grief underneath all the anger. And let me respond to Lynn. Lynn said he graduated top of his medical school. He said during the deposition that I should be grateful that he paralyzed me because I was no longer in pain. I only had spinal stenosis. But he never did give me an MRI or a scan. Oh my God. I don't think. He said you should be grateful. I'm having difficulty controlling myself right now. Julie, how about you? Hearing what Lynn just said.
Yeah,
Yeah.
But you said it in a deposition. It's, oh gosh, yeah, just.
All right.
That's because you can't do too much. You can't respond back. That's difficult.
Yeah.
I keep hearing somebody like, is there somebody on the phone that wants to say something? Star 6 will unmute and star 6 will mute.
What do you do? Star 6 1.
Yeah, star 6 will mute, and I hear whoever was talking. I hear you. So.
Okay, star 6. Then you get to talk.
No, you're on. We got you.
Oh. Okay. Well, I did. I feel kind of selfish asking this because you read my part of my statement about my daughter, and she's become a stranger, and she was involved with drugs, and I've always been like her best friend, and now I told her the other day I don't know her anymore, but I keep telling myself it's because she doesn't have what she had before. But are you there?
Yeah.
Oh, but I just don't know. Maybe I just didn't know her before, and I feel very selfish as her mother, feeling bad. I'm trying to put boundaries up because she literally just goes ballistic with me. But she's fine with everybody, and I can't even imagine being in her shoes. And do I just distance myself? I mean, she was on drugs.
You just what?
Do I just distance myself from her? I mean, she's my heart and soul. You know, she's my everything. But she loses it with me. She's on a ventilator, or she's getting off the ventilator. She's done so many amazing things, but she's always angry. And everyone says it's because she can be angry at me because I love her unconditionally. Is this true? It's really hard to grasp.
No. That's not true because it doesn't make sense. She's on a ventilator now?
Well, she's on the ventilator. She's got a C12. She got in an accident, and she knows that this whole thing was her. And she did drugs. She was an addict, and if you met her, you wouldn't know it. But she lost control of the bicycle and went through a window, and she came out as a C12, complete A, with nothing. No, she wasn't doing anything, and she was on a ventilator. And now she's getting off the ventilator. She's cognizant, but she's always mad at me, always. And I don't understand. I bring paperwork to her, or she's not mad at her dad, who she will tell you we're married, but she didn't see much of him. He always worked. But she always takes her anger out on me. She's fine with all the nurses all I've ever done was just love her, and she's always was close with me. What happened?
How long
Is there shame?
How long has this been that she's been angry at you?
About probably 6 weeks. At first, she wanted to come home. She wanted me to take care of her. But she was always very edgy. That's why I guess she did drugs. But she's always loved me. She's always kept in touch with me. And now she's a stranger. I don't know it.
Yeah. My heart breaks for you. It really does.
I would have done my whole house and taken care of her, but she's so short with me. We don't even have any money, but if I tell her something I have to get information from her to do paperwork. She yells at me that she doesn't understand, and I'm like, I'm just giving you the papers, you know. And then the psychologist said it's because I'm going to love her anyway. And it's so hard. On the phone.
We can conjecture about, she's angry at you because you're the safe person. But, all that doesn't matter, does it? I mean, it doesn't make you feel better. And it
no, but I want to know if it's true.
If what?
If that is a true statement.
Well, we can't know. And we can't know, certainly, we can't know in the short run.
She always tells me she loves me, but she doesn't treat me well.
Yeah. And it's been 6 weeks.
In 3 months. She's been in the hospital for 3 months. She's in rehab. She's made incredible strides. Nobody can believe how far she's come. Yet she's always angry at me.
Let me ask you a couple of questions. When was her accident?
When? It was July 27th.
About 6 months?
I'm sorry, what?
Is that when her anger started?
No, it happened probably maybe 2 months ago. Yeah, when she started. She was there. Yeah, probably 2 months ago when she was starting to get out of her. When she was on drugs, she's an addict, and I don't know. I'd say at least 2 months. 2 months, but not at the initial accident. She wanted me there, and because I've always been there for her. I'm the only mom that would go visit a kid who was a drug addict because I loved her no matter what. I didn't buy her stuff. I mean, I got fooled for years. I just loved her, and she knew that.
So let's.
And now, I'm sorry.
Let's play something out here, you and me. I'm sorry, I forgot your first name, or if you gave it to
Elizabeth. I feel like I don't want to take up everybody's time. There's people out there who you're right, who are in situations where they're not getting their care, and that makes her angry. And I don't want to take over this conversation because other people might have really important questions who are in a far worse situation than I am. Mine's emotional. Theirs is emotional and physical.
Elizabeth?
Yeah.
Let me worry about that, okay?
Okay.
In the meantime, let's take care of Elizabeth. We'll allow that to happen.
Okay.
Okay. So, if you were to ask her, and I'm not suggesting doing it now, maybe next week, what would you like of me? Like me to stay? Would you like me to go? Would you like me to call periodically? Whatever you would like of me, please tell me.
Well, she does tell me. She says, I just want you to be a mom. I'm like, I am the mom. I bring the papers and I bring the whatever she wants to her. And I can't always...
Well, you know what it means to be her mom. But...
Yeah.
But that might not jive with her definition of what you. She might need you to just be her secretary for the moment, her manager for the moment, and not her coach. I have
Well, that's what I've been doing. And then she gets mad because she doesn't want me to do it, but then no one else is going to do it. You know, that's the thing. She doesn't want me to control her life, but yet, and so this is so hard.
Okay. How old is she?
25.
Right now, at that age, and especially after this accident, we all feel out of control. And the last thing we want is the experience of being controlled.
Right.
You know, I remember they came in before my surgery, my spinal fusion surgery, and they wanted to shave my beard. And I said, that's not going to happen. I said, I've lost enough. I'm going to lay in this bed and I'm going to die before you shave my beard. I mean, that's how adamant I was over a beard. You know,
well, yeah, you're controlled.
And I like to think I'm a little less nuts now, but I'm not sure. So, you know, the last thing we want is to feel controlled by someone else.
Right.
My advice to you is let her take control. Let her determine what she wants of you. Let her define how you can be most helpful. Everything's going to change now, right? She's feeling more dependent on you.
Right.
And my guess is she hates being dependent.
She's a free spirit, yeah.
And my guess is that hatred, you know, lands on you. And what you have to do is, I hate to say this to you, but you have to respect her mission at this point.
Yeah.
And things are going to change now for you. Things are going to change in this relationship. And you, neither you nor your daughter, have any idea what tomorrow is going to look like. Literally, tomorrow, Thursday, let alone tomorrow, a week from now, or a month from now, or a year from now. You can guarantee it won't look like it does today. It could be better or worse.
I'll give you an example of what happened yesterday, or the other day. I didn't want to be her payee rep. I didn't want to have anything to do with it because I never thought she needed a payee rep because she's cognizant, can take control of her own finances. So she tells the social worker she wants me to be her payee rep. I said, I don't want to be a payee rep because she's going to yell at me because that means I'm in control. So I'm totally confused. I don't want to even do it. There's nobody else to do it. It's just I keep getting mixed messages from her. Help me, but go away. Bring me my papers, but don't talk to me about it. I'm like, what? It's insane.
So let me be the voice of your daughter for a minute, okay?
Okay. Yeah.
I'm crazy right now.
Mm-hmm.
I want you to love me, even though I feel crazy. I want you to love me for my craziness. I want to punch you. I want to hug you. I want you to take care of me, and I want you to go a million miles away from me. And I want all those things because I feel crazy in my head right now.
That's what I thought.
And what you have to do, and this is Dan talking to you, is you have to love her the best you can without letting yourself be destroyed in the process. You have to take a really honest and tender-hearted look at you. And if it hurts too bad, you need to back away for a day. You need to catch your breath. You need to eat well. You need to sleep well. You need to be in your life every single day. Because that's the only way you're going to deal with, A, your own losses, and B, trying to love a daughter who's now handicapped and feels crazy right now, like most of us do.
that's another thing she would say to me, like, why are you looking at me like that? And I said, Rebecca, when you hurt, I hurt. She doesn't live with us. She lives 100 miles away right now. And I was driving back and forth over mountain passes to visit her. And I did tell her the other day, I said, look, Rebecca, I called her. I said, I feel like I don't know you, but I do know that I love you. And that's all I could say. I don't know what else. I don't know you anymore, but I love you. Was that unkind to say to her?
No.
I wanted to be mean. It was?
No.
Oh.
That was,
Oh.
no, it wasn't.
I don't want you.
It wasn't unkind to say to her. You were expressing your own fear. And if you're going to say anything to her, you talk about what goes on inside of you. How helpless you feel, how impotent, how you don't know how to love her in a way that's respectful to her. That this is all new for you too. These are all new waters. And you're confused and scared, and you cry yourself to sleep at night also.
And I feel ashamed because how can I cry when I'm not the one that I could move and she can't? I feel like such a failure.
The first person that cried in front of me was the first time I felt human again.
She gets angry if I cry. She gets mad. She doesn't like tears.
Yeah. Then don't cry.
Okay, well, thank you, Dr. Dan.
Yeah.
I appreciate your help.
You can come to New Jersey and cry in front of me all you want.
Okay, thank you so much.
Listen, please keep me posted on my discussion. At Healing Heart and Mind. Okay, we can continue the discussion there.
Okay, thank you very much.
Please take care of you.
Okay, bye-bye.
So, that's the voice of a loved one with newly disabled and angry like most of us were, or maybe still are, I assume. The whole thing is heartbreaking on both sides. Was there anybody else who wanted to join the conversation? I thought
Dr. Dan?
Yeah.
Hi, Pete Wenzel here. How are you?
I'm good, Pete. How about yourself?
Good. Hanging in there, and it was a heartbreaking call on the last one there.
Yeah, it sure was.
I was angry, very much so, enraged. I was put on antipsychotic meds and given killers enough to kill you, but I also was very mad at God when I was told that when I went in to the hospital, I walked, and when I woke up from surgery, they removed a spine tumor, and I learned I would be likely never walk again.
When was that, Pete?
That was almost exactly 5 years ago.
Mm.
So what I did is I got very angry. I didn't really know where to turn. And my family had certainly had their fill. So I turned to God and was angry at God. And how could a God, up there allow this to happen to me? And I doubted the existence of God. So I decided when I was going to try to do my best to go on the internet to find out whether God existed or not. and what I thought would reveal, that science had proven God is dead, I found quite the opposite, and good arguments on the other side of the equation as well. And, slowly from there, I started pulling out of my anger and directed my attention towards my studies of this because I found it fascinating, but it at least gave me a sense of purpose and meaning, and the anger subsided. And so that's what's helped me get through this, and I don't know if that's a topic that is appropriate to discuss here or not, but it's something that helped me. And I thought I could throw it out there as, for people that, if they had doubts or were mad,
You said a couple of things, Pete, that were important. One is that regardless of the content, and in your case it's, God, but what you did was you found meaning. And once we find meaning, regardless of what that meaning is, once we find meaning, we feel connected to our species, to the world, and very often that meaning that we find is about others. You use the word love, I think, if I heard you correctly.
Well, that's the underlying, theme of everything, and it did. You're exactly right. It got me out of myself and into wanting, to forget self and ego and go out and attempt to help others. And I think there's some real freeing energy in doing that.
Yeah, I forget the author who wrote Les Mis, but and if somebody wants to chime in, I'd appreciate it. But anyway, the song was, love changes everything, how we live and how we die. And what we're hearing today, and we just heard, that what changed everything is a sense of love lost. This poor mother feels she lost the love of her daughter. Love changes everything. Love acquired, love lost. And the one thing about love, Pete, and the one thing you've discovered, is we cannot control who loves us, but we sure as hell can control who we love and how many people we love. That really is the issue.
Right. I agree.
And meaning, and the meaning was about love. And there's so much research about that now, about how things change when we find meaning. And you talked about the ego, Pete. You know what? Mm-hmm. Very often, the ego causes us suffering, but, it's there for a reason. And, it gives us an identity. And, on a certain level, it gives us a purpose. And when we need it, it tells us who we are. And very, very, very often, the ego gets us in trouble. But, you can't just turn around and castrate the ego. It's not that simple. But, the more we love, the more that ego is going to kind of melt away. And it becomes about love and not about I with a capital I.
All right. Well, it was a change of direction for me, away from my materialist, reductionist type of worldview to something less, ego-driven, where I'm not out for 52 years prior trying to, get a good job, and then I started my own company and accumulated material wealth and, and thought that my payoff was going to be, early retirement that I could enjoy with my wife and all that stuff. But what I found is that by, not completely wiping out the ego, but certainly not letting it drive me down that road as much. I still have, interest in it, but I prefer, and I find more fulfillment, more happiness, more peace by, veering away from the ego. And now that's not something that somebody can do in the first, 6 months of this, but I just wanted to offer that there is some light at the end of the tunnel for folks who may be listening.
Well, I appreciate your call, Pete, and I'm very, very, very happy for where you are at this point in your life. I wish you great peace and happiness in that order.
Thank you, Dr. Dan. Thanks for letting me speak today. I appreciate it.
Take good care of you.
Yes, you too, sir.
So, anybody else want to hang out with us for a while?
Hey, Dr. Dan, this is Candace Cable.
Hey.
How are ya?
Yeah, I've heard of you, and I'm
sure
everybody in the web chat has heard of you also.
Oh, well, you and I have had some good conversations.
Yeah, we have.
Definitely.
So, dear Candace, what are your thoughts and experience about anger?
Well, I wanted to run something by you that happened to me last night that made me angry. And I was sitting in the airport waiting on a flight, and so I had some time. I thought I'd relax a little, so I jumped into one of the airport seats and propped my feet up on my wheelchair so I could get a little elevation going, and was had my head in my phone, just checking things out. And this woman walks up, stands in front of me, and says, "Do you need help?" And at first I thought, when I heard that, I thought, oh, maybe it's the gate agent checking on me. And I look up, and it's just, a pedestrian person. And I said, I looked at her, and just looking at her made me irritated that she said that, because I hadn't asked for anything. And so I said, did I ask you for help? And she said, no, I just being nice. And I said, well, wait until I ask for help. And she said, well, I'm just trying. I go, I'm fine. I'm sitting here minding my business. If I need help, I'll ask you. And then she was irritated with me. She was upset and walked away. And I thought, is there a better way to handle that? Because it irritated me. It made me mad that she just came up to me, and I feel like there's some stereotype or preconceived idea or something about me. I mean, did she do that to everybody that's in the airport? Just want your feedback on that.
Yeah. Well, I've got a couple of thoughts, but after I do, I want to ask you a question. When I give lectures to audiences around disabilities, I comment on the language we've used over the years and how language has changed. We go from cripples to invalids to so on and so forth, and from disabled to differently abled, and now for the moment I think we're special needs. And I say to the audience, what special needs means is that my needs are special and yours, not so much. So, I like that. But, it does mean we look different than others. And we ambulate different than others, or talk different, or act different than others. So people are inevitably going to react. And sometimes, we've all experienced this, Candace. God knows I have.
Mm-hmm.
And, sometimes it does trigger anger. The question is, what goes on inside of you that was behind the anger? What emotion did you feel just a split second before you felt anger?
Oh, what I felt was, I don't. Is irritation an emotion?
Yeah.
Well, I felt like she was making. Oh, okay. So I felt like she was making an assumption about me that I wasn't capable.
Okay.
Yeah. If I explore it a little bit like that, that's what it felt like in the past. That's what it felt like right there was, and that she was singling me out for whatever personal reason, for her to, I'm going to do something nice for this person who needs in a wheelchair, and I'm going to ask them if they need help, and it can almost even, I can feel a piece of it that she's taking my empowerment, my control away by assuming that I might need help and not letting me ask for it if I need it.
So,
the control piece that Elizabeth talked about a little bit before.
So here's the deal, Candace. Here's what we know. This woman said to you, whatever she said, can I help you? And where it goes from there is first you have an emotional reaction. And then, because unfortunately you have a mind, so your mind takes over and you tell stories. That's what our minds do. So you tell stories, what she was thinking, what her motive, how you feel in response to what she's thinking, and now you're pissed off.
Mm-hmm.
And you have no idea what she was thinking.
Right.
You have no idea. This has happened to me, and when it's happened and it's been distracting, I might quickly react with irritability. And times when it's not, I won't. I remember being approached by a group of young people who, I hate to stereotype, but it was clear they were young kids, so it looks like they were studying to be evangelicals, So, the young kids, there was a group of them that come up to me in the subway, and he puts his hand on my shoulder, and he looks down, and he says, "May I pray for you?" He says, "God wants you healed." And I pulled his ear down to my mouth, and I said, "Son," I said, "what makes you think I'm not already healed?"
Mhm. Wow, that was awesome.
He backed away, and he got a little education there, about the way things really are. So, sometimes I get reactive and angry, but whenever we do, it's always about our stories. It's like when I suffer, Candace, from physical pain. And I used to tell stories about it. I'm going to have this for the rest of my life. It's going to get worse. How am I going to live with this? Yada, yada, yada. And now, when I feel acute pain like that, it's just pain. There's no stories. It sucks. It hurts like hell. But there's no stories. So there's not that much suffering. All we know is that a woman approached you at the airport. Misguided, maybe. Maybe not. Kind, maybe. Judgmental, maybe. We don't know any of those things. Just she came up to you at the airport and annoyed you.
It annoyed me.
It's the stories that cause us suffering. But, unfortunately, we have minds, and minds tell stories.
Well, and I really wanted it to be a teaching moment, and what I said to her was out of the ordinary of anything I'd done before, but it felt like it came off really angry.
Yeah.
And maybe it needed to be that. I don't know.
You needed it.
Yeah, I needed it. Yeah. So that's all that really mattered there, right? Is it?
Yeah, in hindsight, of course you wish you hadn't hurt this woman, but it was your way of protecting yourself from shame, from embarrassment.
Mhm.
That's what we do.
Yeah. Yeah. Thank you. I have been thinking about it today and thinking about how did it this way or that way, or because it, as you said, it happened so much to us, and I really wanted to be. I love that you pulled his ear down and made him think about it, and that's what I want for people.
If we had time, we could exchange some great stories about for all of it. But unfortunately, we're out of time.
Yes.
Candace, you and I are going to hang out next month at your chat.
We are. I'm so excited. I'm going to have you on Adapting Life, and I'm going to be. I'm not sure what we're going to talk about yet. We need to spend a little time together and figure out what we want to talk about.
We're both smart. We're both smart.
It'll be our teaching moment.
Listen, we got to remind we're out of time, and if we have to pay overtime, I think they're going to make me pay. I can't take that risk.
Thank you, Dr. Dan.
Thanks so much.
Sure.
So, everybody who did join the conversation, I really appreciate it. I'm grateful. My heart breaks for those of you, for those of us, all of us who sometimes suffer so much. I appreciate your honesty and your vulnerability. Julie, I appreciate your hanging out with us again this month.
This is fantastic. I'm so happy that people got to ask their questions, and the two, Elizabeth and Paul and Candace, got to speak up, and we had the time to talk. So that's really wonderful. I learned a lot, as always.
Gift for all of us. Gift for all of us. Take care, Julie.
All right. Thank you. Thank you, everybody, for joining us today. And please join us again next month. And also, if you want to ask and leave any questions for Dr. Dan, please visit our online community at christopherreeve.org/Dr. Dan. And this presentation is being recorded, and it will be up on our website by the end of the week. Thanks, everybody. Have a great day.
Thanks, Joel. Bye-bye, everybody.
Bye.
Thanks. Bye.
Thank you. This does conclude today's conference call. You may now disconnect.